Hey, everybody, welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thanks so much for joining us for this conversation tonight. We are talking about masks, and we're doing a question and answer session that I hope will answer some of the questions that you have submitted. Feel free to join in and post online right now if you are watching us live via Facebook with The Oregonian. We do this show in partnership with The Oregonian, so we welcome those of you who are tuning in live. I posted recently a question about masks because Oregon, along with Washington, is set to remove the mask mandate that's been in place now for a couple of years. On March 12th, it will be lifted, and it's been a series, quite an ordeal for us here in the Northwest, as well as around the country and around the globe. When it comes to masks, it's really a central point of debate that a lot of us have engaged in. I posted a question recently about whether you would keep wearing masks even after the mandates are lifted, and there was such a strong response to this on Facebook. There were some 200,000 comments, nearly 1.6 million people reached with that post. So I figured that it would be a good time to bring in and have this conversation with the Oregon Health Authority. Our guest tonight is the medical director for the Oregon Public Health Division's Communicable Disease and Immunization Programs. Dr. Paul Cieslak joins us live right now to talk about the lifting of this mandate that has been in place. Dr. Cieslak, thanks so much for being on That Expert Show.
My pleasure. Thanks for having me.
A lot of people have submitted questions, and I hope we can get to this in all the time that we have tonight. But the first question I wanted to start off with is, why now? In terms of lifting the mask mandates, what factors went into this decision and the timing of this decision here in March?
Well, I think the biggest thing is the declining case counts. They're declining largely because there's a lot of immunity within the population. Most of Oregonians have been vaccinated at this point, fully vaccinated. Many Oregonians, around over a third, have had a booster dose as well. And then the infection itself provides a significant degree of immunity to another infection. Now, immunity by neither vaccine nor by a prior infection is perfect. You can still acquire COVID-19 after either of those, but they tend to protect you pretty well against hospitalizations. And so when Omicron came on, we just saw disease go crazy. The number of cases just went through the roof. And I think as a result of that, most Oregonians have now either had the disease, whether they've had it or not, or they have the immunity because they got vaccinated. And we hit a peak of 1,130 persons in hospital. Our concern has been the numbers of people in the hospital. It can really overwhelm the system, and I think it's fair to say that in some regions of the state, the hospitals were overwhelmed when we hit that 1,130 number back on, I think it was January 27th. But after that, numbers of people in hospital really started to plummet, and I think it's because we hit that tipping point where so many people were immune, or at least immune enough to keep them out of the hospital, that hospitalizations plummeted. And in just a few short weeks, we're down to case counts are down 92%, and the numbers of people in hospital are down about 70% already. And so they're really plummeting, and this gives us the confidence that we can start to lighten up on some of those restrictions.
I think those numbers are encouraging, but I think I would be remiss if I didn't ask you about some of the skepticism around the factors that went into this decision making. There's been reporting done by the New York Times about the timeline and how, starting in November with an election in New Jersey that seemed to be surely for a Democratic governor, it became tighter than anyone thought it might. And the research done afterwards showed that the mandates around COVID, masking in particular, were a large factor in that. Then came the governor's meeting in D.C. with President Biden, and the governor's coming out of that saying, well, it seems like, we need to rethink the hardline policies around COVID. and the presumption being that the elections in this coming year and the next couple of years could be affected. So what do you say to people who are convinced that politics really played a huge factor in this over the science and over the factors of public health?
I see, yeah. Well, what I can tell you is that we have a group of public health physicians within the Oregon Health Authority's Public Health Division, and we get together pretty regularly and discuss, what should the policies be. We go over the data, and I think we're all pretty familiar with them. And never in any of our discussions have political considerations come to the fore. We're basically looking at what is the health burden, what is the health benefit to be gained by masking, in the face of most people being having some significant immunity anyway. What are the downsides of masking? There are some downsides. For many of us, it's just a minor inconvenience. Speaking for myself, anyway. But if you're a child who's learning how to speak, we've heard from teachers that the masking can be a significant impediment. So. It's something that we want to take off when we're able. I would note that as Omicron swept across the country, it kind of went from east to west, and Oregon, Washington were some of the later states to be hit. And along those lines, we're some of the latest. We are some of the latest states to take off the mask mandate. So I think that the states have been taking off the mask mandate as they watch their case counts drop, and felt that they weren't quite as necessary anymore.
How concerned are you when you talk about, the downsides of masking? I hear a lot from parents who are concerned in particular about their kids and middle schoolers and teenagers, the older kids that have been affected by this, and the social implications, the mental health concerns regarding masking. And even as we prepare to make this transition, a lot of the kids who don't want to take their masks off because they've been so accustomed to wearing them, and the impact of that.
Yeah, I'm not an expert on the mental health consequences. As I say, I've heard from public commenters who comment on this, people who are in there teaching kids, and they have many of them have made these comments. As for the kids who have just gotten so used to wearing the mask that they find it difficult to take it off, I have some sympathy. You've become accustomed to it, and then this is something different, and you're going to feel exposed when you take the mask off. But I think it's important to remember that that's the way we go through most of our lives. Last summer, before Delta hit, we were all taking the masks off, and then we got hit by this new variant, and it kind of turned everything around. And then just as Delta was going away, and we thought we were in the clear again, we got hit by this Omicron variant. But at this point, so many people have been infected already. That's what gives me a lot of confidence that we're not likely to see a huge wave like we did with Delta or with Omicron again. So all I can say is, it may be a little more difficult for some people to take the mask off than for others. But I think in general, for the great majority of people, it can be done safely.
That leads to a question that was submitted prior to the show of whether we should expect an increase in hospitalizations or an increase in infections with the lifting of these mask requirements. Are you anticipating that?
Yeah, that's a great question. I do anticipate that transmission will be a little bit higher than it would have otherwise. But case counts have been plummeting so dramatically that I'm confident that, let me say this, I'm optimistic that we're unlikely to see a big bump in severe disease, in hospitalizations. We may see a slowing in the rate of decline of people in the hospital, but right now I'm optimistic that we'll continue on the trajectory that we want to see.
I want to thank folks who are joining us live right now. Stefan is asking on the Oregonians Facebook page, are there plans to having a return to masks in schools during the next flu season? I'm going to couple that with another question from someone on Twitter who is asking, should we have to pivot back to masks? How much lead time would you be giving people before going back to them?
Right. That's hard to say. In general, with hospital rates low, we're probably not going to be going back there. We'll be keeping an eye on the case rates. And CDC has published what they call their community levels that look at case rates within the population, but more importantly, new hospital admissions and pressure on the hospital catchment areas. In your area of the state, for example, how are the hospitals doing? Are they looking like they're being overwhelmed or not? And they have programmed these so that they would hope to catch it early and be able to indicate that in this region of the state, or maybe for the whole state, it's looking threatening, and it's time to start, taking measures again to prevent the spread. So we'll be looking to those metrics and adjusting accordingly.
I have one person on Twitter who is asking whether members of the Oregon Health Authority, virologists or immunologists, are you feeling personally safe enough that you would eat in indoor restaurants or drink in indoor bars or go without masks on an airplane?
Well, if you're asking me personally, I'll say yes. I don't have underlying conditions that put me at high risk. I'm 61, so that does portend some risk for me. But on the other hand, I have had COVID, and I'm fully vaccinated, and I'm boosted. So I've had 3 doses of vaccine, and I've had COVID. And I personally am quite confident that I'm protected at least enough to keep me out of the hospital. And I think going forward, an important point is that, to some degree, people are going to have to assess what their risk is, and talk to your doctor if you need to. But in terms of are you vaccinated, have you had the disease before, do you have underlying conditions, how old are you, what kind of settings are you going to be in, what are the people around you doing, are they vaccinated, and people are going to have to come up with their own notion of what their risk is, and then if they figure they're at high risk, to either avoid those settings or put the mask on, or both.
Do you still stand by the Oregon Health Authority's decision, or I guess the state leaders' decisions, to require masks in schools for as long as we have, especially with the more recent research that showed that, the transmission levels in schools, even when Omicron began to, infect children, simply was not that high?
Yeah, yes, I think we're taking the masks off at about the right time, because even though we didn't see that much serious disease among kids, we do know that kids get the infection, that they're just as capable of transmitting it as other people, and the numbers that are cited often about the safety in schools deal with kids that are being masked. And so we do think that they're effective in that setting. And so we had to consider, if when hospitals are being overwhelmed, back in late January when we had 1,130 people in the hospital, would that have been an okay time to take the masks off of kids? We didn't think so. We thought at that point it would be imprudent, and we really wanted to see that important metric moving in the right direction before we started lightening up on masking requirements.
You can certainly understand how people are wary about certain situations in which they may feel like they still want to wear masks. Kathy on Facebook wanted to know, how much good does it do to mask if most people in a certain setting are not? For example, would a surgical mask in a yoga class do much good? Or, because the N95 and the KN95 masks are simply too hard to breathe in?
Yeah, that's really a great question, because there is going to be some risk going forward, and one of the things I try to explain to people is that safety and risk are not all or nothing things. They occur along a spectrum, and certainly it is best if the person who has COVID has a mask on. And because, especially with Omicron, you can have COVID without having any symptoms or having very mild symptoms. You don't even know you have it. And meanwhile, you could be transmitting the infection. And universal masking, was designed to prevent that sort of thing. And so it's certainly best to have the source case, the source of the virus masked, because, that'll keep most of it, from getting into the atmosphere anyway. Nevertheless, studies do show that there is a benefit to masking yourself. There was a really nice study published out of California just a couple of weeks ago that showed that even with the most basic type of mask, a cloth mask, which is certainly not the best, there was 56% protection against a symptomatic episode of COVID-19. And that's significant. Now, it's not 100% protection. There were people who wore their cloth mask and still got infected, but it significantly, reduced their risk. And then a surgical mask provided about 75% protection, and then I think around 90%, I can't remember the exact number, N95s and KN95s provided still more protection. So, yeah, those are, the respirators, N95, KN95 are definitely the best thing to have. The next best would be a surgical mask, because in addition to some filtration properties, it has it'll trap the particles coming out of people's mouths with hydrostatic properties, sort of the charge on the particles. It'll attract them that way, and it provides more protection than a simple cloth mask. So, I think people are going to need to assess their risk and decide, what is going to work best with them. What will they wear? What can they wear and still do the activities they want to do and get the most protection?
And I mean, frankly, one of those considerations may also be to know who you're around, right? I mean, for example, if you lived in an area where the vaccination rate simply isn't high, you have people who adamantly believe that the vaccines didn't work or, were poisonous or along those lines, then that's one thing to consider as you go into a setting like that.
Sure. Or look at your local case counts and hospitalization rates. Right now, those are still pretty widely available. And if there's a lot of people in your region being hospitalized, then I would say there's certainly evidently some risk, and take that into account.
We have more questions, too, about particular settings. This is kind of an extension of the previous question. This is from Lisa on Facebook, asking about vigorous exercising, which has shown that there's a higher rate of infection indoors when people are vigorously exercising. And this person's wondering if it's still included in the plan to no longer require masks, or whether there will be exceptions in places like in a club where people play a competitive sport like basketball or volleyball, especially if a ventilation system in that particular setting is not great.
Yeah, ventilation is a very good thing to have, and one of the things going forward that we're trying to encourage is facilities to maximize their ventilation. Get the stuff out of the air, get the air that's in there out of there, because viruses can hang out in it and infect people. But no, we're not. The short answer is no. We're not making exceptions for those types of facilities. The caller or the writer is, the question submitter is correct that with more vigorous exercise and more ventilation, more air coming in and out through your nose and mouth, the more likely that an infected person is to spread the virus around. That said, I think the people who are going into those kind of facilities need, once again, to assess their risk. I think, you can wear some masks while doing that sort of thing. It does become difficult to wear an N95 or a KN95, but you can wear, for example, a surgical mask, I think, without too much problem in a facility like that, if you're concerned about it. But we are not making exceptions and saying that people in those areas have to mask.
When you look back at the decisions that were made by Oregon, and I guess you can really only speak to Oregon, are there things that you feel like should have been done differently? Are there regrets that you have in the role that you're in that you can look back now and say, gosh, we should have really not done this or pushed harder on this?
The biggest mistake that I made is not appreciating that COVID-19 could be spread by the airborne route. When we first learned about it, it was rapidly known that it was a coronavirus. And, people in my line of work know coronaviruses as causes of the common cold. And they tend to spread via what we call the droplet route, which means water-heavy droplets that are expelled from your nose and throat when you cough or sneeze. And because they're water-heavy, they fall to the ground within a few feet. And if you go back to the early stages of the pandemic, it was all about 6 feet distancing, which I still think is important, but it was only about 6 feet distancing, and we kind of poo-pooed the notion of masks. But some outbreaks came to light where it was clearly spread by the airborne route. And by the airborne route, I mean tiny particles that are coughed into the air, and they dry out rapidly because they're so small, and they can stay suspended in the air for long periods of time, and they can infect people at a distance and just from inhaling the air that the other person coughed into. So, for example, there was an outbreak in a Chinese restaurant where many people were infected. This was very early on, and one person came in with COVID-19 and managed to infect, almost everybody in his area of the restaurant, whether he was within 6 feet of them or not. And it's stories like that. The outbreak at the church up in northwestern Washington was another such outbreak where just about everybody in the choir was infected in a short period of time. They made us realize that this was spread by the airborne route, and we really needed to start embracing the idea of putting masks on people. And we did so, I will say, reluctantly and belatedly.
So what you would have done differently in your role is to begin with the masking sooner than what was carried out.
Yes.
It's interesting because I think there's still a lot of people that have suffered tremendously. We've lost loved ones. There have been so many sacrifices made. There were people who have truly felt the impact of this pandemic. What would you say to people that are angry? I mean, when I hear from people, some 200,000 people that have commented on this particular post, and I've been really interested in reading reactions because these are emotional responses to how this pandemic has played out in their lives and the role that they feel like the government has played in the pandemic with the mandates and whatnot. What do you say to these folks? Because I'm sure that you hear from them as well.
Yes, we certainly do. All I can say is I get it. The measures that have been undertaken are unprecedented in my lifetime. We've all had to put up with, I think the masking is one of the least things we've had to put up with. But as I said, even to that, there are downsides. But businesses closing, people being out of work for long periods of time, people not being able to go to church, people not being able to see their loved ones in a long-term care facility who might have been very ill. All I can say is that, I sympathize, and all of us who have been in public health have been, feeling the same thing. But by the same token, COVID-19 is a real thing. I've heard some people tell me now it's just a common cold. Omicron appears to be less serious than other variants, thank goodness. But Omicron has killed a lot of people, and we've had mortality rates like 20% above normal in Oregon, and so I think that extraordinary ills have called for extraordinary measures. By no means have we done everything right, and I'm sorry for the things that we haven't, assessed correctly from the get-go. But I hope people will take into consideration the how nasty a thing COVID-19 really was.
Can you advise businesses, because I'm hearing also from a lot of small business owners who are understandably uncertain, a little bit confused, and kind of stressed out about the path forward. They're having to make adjustments to the changes that were made during COVID to increase spacing and whatnot. And some of these business owners actually want to continue masking employees and perhaps asking customers to continue masking. What is the advice for them, and can they even legally proceed with a requirement on their premises for customers to wear masks?
Sure. I'm not going to tell a business owner how to run his business, because I suspect that across the state, different types of businesses are going to have clientele with very different opinions about whether there should be masking when they go into the business. And I think business owners are probably pretty adept at assessing what their customers would like. What I will say is that, yes, by all means, you have the right to require masking of your customers when they're coming in, but you are also required to undertake reasonable accommodations for people who cannot mask. And if you are going to require masking, you should have masks available for people who don't have one. And if there's somebody who has a bona fide reason why they cannot mask, you need to take reasonable steps. And this is a legal thing, and you may need to talk to your counsel about it, but you need to take reasonable measures to try to accommodate them without their mask, which doesn't necessarily mean you need to let them in without a mask, but it means you need to try to serve them where they are.
Got it. Moving forward, based on what we've learned now about COVID and how it's playing out, what do you see this next year looking like for us? Are we going to see a surge in the fall as people head indoors once again, like we have in the past traditionally with the flu season? Can you paint a picture for us of what this will look like moving forward?
No, I don't know exactly what it will look like. What I'm hoping for is that I don't think we can hope that COVID-19 will go away altogether. We are never going to reach the level of herd immunity necessary to make the virus go away like smallpox did and like polio has in this country, because our immunity is not long-lived enough. It wanes. Immunity from both infection and from vaccination wanes. What I do hope, though, is that immunity against severe disease is more long-lived, but the virus will continue to be transmitted. Maybe those transmissions will give everybody a little boost in immunity every time they come through, and I suspect that we will settle into a long-term pattern. I hope at a very low level of a lot of people getting COVID-19, but a very small number of people getting severe COVID-19. Whether it will be seasonal or not remains to be seen. There is kind of a respiratory virus season. It's driven by influenza and respiratory syncytial virus, which is a virus that, we're used to little kids getting severe disease. And that definitely, sort of comes around in November, December, and lingers until February, March. And causes a lot of illness around those times of year. But there are other respiratory viruses that are kind of steady state throughout the year, and we don't know where COVID-19 will land. We don't know whether it will be seasonal or whether it'll just be kind of, floating along with little bumps here and there. I think it'll be indefinitely.
Sorry to interrupt. So help me understand, I've had friends and family, they've gotten COVID multiple times, which I don't understand the how that is the case and how it's been explained to me or how I've read about it is that, like the common cold, or what we refer to as the common cold, the version of the virus that you're getting each time is slightly different than perhaps the one that you got before, and that's why you can get COVID more than once?
No, I think you can get the same strain of COVID more than once, even if it hasn't mutated. So both things go on. When it's interesting to watch the projections of COVID-19 that OHSU was generating, and near the end of the Delta peak, he had an estimate of how many people were susceptible, and it was pretty low at that point. But then Omicron came, and it was apparent that your immunity to the previous strains wasn't as good against Omicron. So the estimate of how many people were susceptible suddenly bumped way up. So we could see a new variant that, to which people don't have much immunity. But we have definitely seen that people can get infected with Omicron more than once, with Delta more than once, with Alpha more than once. So the immunity against infection, your antibody levels wane, and we think it's the antibodies that protect you against infection, but we think it's other parts of the immune system, what's called cell-mediated immunity, plays more of a role in preventing severe disease, and that cell-mediated immunity is more durable. It lasts longer. It involves memory cells in your immune system. So both things can be true.
And that kind of protection, the latter that you are referring to, comes from antibodies that are generated from having had the disease or from a vaccine?
Both can give you that kind of cell-mediated immunity.
Okay. And again, you might have already said this, but as this plays out, future strains of coronavirus are anticipated to be less severe, or is it possible that they will mutate in a way that we'll suddenly get a strain that attacks in a very severe way?
I think it's possible to get a more severe strain. What your questioner probably knows is that over time, as a virus is in a human population, it does tend to become less lethal. In infectious diseases, we say that a good germ doesn't kill its host because the germ will survive better, survive longer if it can remain within its host and be shed for a long period of time, kind of hang around forever and just continue to infect other people. But if a germ kills its host, it's not going to be transmitted much from there. So we do kind of see this dance that viruses and humans do, where over time they generally become attenuated, less severe. But it's not a guarantee that we couldn't have a severe strain pop up. It could happen.
One last question here that came in from a gentleman named Ted, who wants to know whether you can confirm that you're still vulnerable through the tear ducts in your eyes to the virus as a point of entry.
I will say no. I don't know. In general, with the respiratory diseases, we have considered a virus landing on any of your mucous membranes potentially to cause infection. Early studies with the common cold definitely demonstrated that inoculation of the eye could cause an infection, and maybe it's because the eye drains through the lacrimal duct, which goes into the nose, and maybe that's where the real infection starts. But we knew that the virus landing on your eye would cause an infection. With COVID-19, because it's a coronavirus, related to these common cold viruses, we sort of assumed that inoculation of the eye could do it. And in fact, in some places, we still recommend eye protection, in hospitals, for example, where it's a little more feasible. But I'm not aware of documented transmission through the eye.
Okay. Anything else that you want to share before we leave you? Some last thoughts?
Well, I just want to say that I'm very optimistic. I'm looking at these numbers of people in the hospital just coming down day after day after day for the past 5 weeks or so, and it gives me a lot of hope and a lot of confidence. So I think as we move forward, we can have that confidence. Those who are really concerned still have the option of masking, and we would encourage you to do so, and we would encourage others to respect that decision. And you'll also have decisions to make about, do you get yourself into large gatherings? But most of us, I think, can get on with life much as we were before the pandemic.
All right, Dr. Cieslak, thanks so much for your insight.
Thank you.
And thank you for joining us for this episode of That Expert Show. We'll be summarizing his key points and putting them together in a tip sheet, which we post on thatexpertshow.com. You can always catch previous episodes, and this one included. We'll put it on YouTube on our channel, as well as we'll put it out as a podcast on Apple iTunes, Google Podcasts, wherever it is that you listen to podcasts. Just search for That Expert Show. What did you think of this interview and the information that he shared? Please let me know. I'm on Facebook, Twitter, and Instagram. Look for Anna Canzano. If you have ideas for future episodes or topics or guests that you think that we should go after, please let me know. I do appreciate that this is a live dialogue with you, the audience. That's the whole idea of why I started this show. This is not a TED Talk. It's a two-way dialogue, and your input is very important to me. So I appreciate all of those who tuned in, and I appreciate even more those of you that have submitted your thoughts and your ideas to make the show even better. It is That Expert Show. It's on Monday nights live here on Facebook. Thanks for being part of it. That Expert Show, where you help run the show.